We are living in the world of evidence-based medicine today, and it is said that a correct diagnosis done is half job done.
As a radiologist, we play a very major role in guiding the clinician as to what exactly is happening inside the body.
Today, the clinicians are unable to move without the information that is provided by the radiologist, be it a liver transplant or an emergency in the abdomen or a chest scan. A radiologist is almost always wanted to give his opinion because all therapeutic decisions are based on the radiology today.
In MR, we have moved from 0.5 Tesla to 3 Tesla, and during this period, from conventional routine scanning, we have moved on to the special procedures which include the tractography, doing functional imaging, etc.
There were a lot of apprehension about the quality of body images and the spine images on 3 Tesla MR. The TX system, to be frank, has addressed all the issues.
The CT scan level, we can do a cardiac scan, which is a non-invasive coronary angiogram, which can tell what's happening in your coronary arteries, whether they are blocked or they are not there. Is there an early disease happening in the coronary arteries? And hence we can warn the patient, who is so-called healthy in inverted commas, that if he takes the necessary precautions, he cannot become a patient in future.
The clue to a diagnosis of a tumor, a aneurysm, AVM, is typically provided by the radiologist.
After the clinical presentation of the patient to the clinician, he would like to know what is the exact cause for it, and that's where the advancement in radiology has helped us to look inside the body without even touching the patient and give a near accurate diagnosis of where is the disease and what is the extent of the spread of the disease.
Imaging of coronary arteries especially has been a very important aspect in making the diagnosis. To the ICT 256 slice with advanced modalities, with CTCA optimally utilizing it, you can reduce the hours of diagnosis mean period by almost 50% to around 3 to 4 hours.
15 years old girl presented to us with the pulmonary embolism. It was a massive pulmonary embolism. This 256 slice CT gave us such a good picture that I immediately took the patient for emergency surgery, and we did the thrombectomy. It was a life-saving on both sides, the right side as well as the left side of the lung.
We have moved from a world of imagination to the world of microscopy, especially on MR. There are certain situations where we can even reach up to the microscopy level.
In CT, we are able to dig out more information, and it almost behaves like a GPS. We can reproduce these images, we can do the volume reconstructions, we can do the 3D display, and the surgeon can pre-plan his surgical event with far more ease and comfort.
With 2 or 3 clicks, edit whatever is unwanted and only see the coronary arteries, which are almost 2 to 3 millimeters sized, and also diagnose the blocks within a period of 15 to 20 seconds. So this is absolutely unimaginable where technology has brought us today.
The role of a radiologist is not to do a scan, but to try and give an answer to the problem if the patient comes to the clinicians.
What does a radiologist want? He wants a super class image, that means high resolution, and at the same time he does not want to give unnecessary radiation dose to the patient. Today we are able to produce very super class images by the help of choosing low dose techniques.
CT scan over here, what we have got is a Brilliant 64 platform with your EBW workstation, which makes it so convenient to scan the patient in a short duration of time, even with an irregular heart rate.
In Philips 64 slice scanner, we have this particular software which auto detects the irregularities in the heart rate and can automatically put them aside and bring out the correct data set.
With this ICT 256, now we are becoming increasingly confident to subject more number of patients as an initial screening tool so that we can plan better.
time we have done approximately over 200 coronary angiographies, and we have excellent results with this Ingenuity CT. The cardiologists are very convinced with the findings and the details that we have been providing them, including the degree of stenosis that we estimate for them.
The imaging and imaging in this radiology field is going to be one of the important tool in future, which will help clinicians like us, will give us more and more confidence for the surgeons to accept the coronary lesions and may go for surgery without doing many coronary angiograms.
Well, the whole 3D of the whole human anatomy is presented to the surgeon, and he gets a good roadmap to go inside before he plans for the surgery. So once he knows how to approach the particular problem, the time frame can be reduced, the anesthesia can be reduced, and hence it decreases the morbidity of the patient following surgery.
So radiologists now are occupying in the past 2 to 3 decades very important role in clinical practice and helping the physicians and the surgical colleagues.
The radiology has helped to a great extent to every surgeon, whether a neurosurgeon or a cardiac surgeon or a general surgeon. It helps the surgeon to find out the disease at an early stage.
Maybe in another decade you find we as radiologists, from a diagnostic to an interventional radiologist, adding up the factor of therapy on these so-called non-vascular tools, CT, MR and ultrasound being used as a guidance to deliver drugs. Probably this will happen in the future.